West Virginia, strengthening child welfare practices statewide. The state of West Virginia is re-envisioning how it delivers child welfare services. The following presentation is an overview of the state's current goals and innovative practices and programs focused on improving the well-being of children and families. Currently, West Virginia's goals for strengthening the child welfare process are to prevent the unnecessary removal of children from their homes through high-quality prevention services and to improve and support family settings when placement is the only option. The Bureau for Social Services has collaborated with sister bureaus, the Court Improvement Board, Department of Education, child placing agencies, and many private providers to develop initiatives that serve families early and in their own communities. The Bureau for Social Services has had several noteworthy successes and accomplishments in its efforts to enhance its community-based prevention services and reduce unnecessary removals. With the passage of the Families First Act in 2018, the state quickly mobilized to take advantage of this opportunity. 3 evidence-based services were identified to include in its Family First Prevention Plan with a focus on expanding availability and educating staff on programs' benefits and effectiveness. These programs include Parents as Teachers, Healthy Families America, and Functional Family Therapy. The state's prevention plan was approved in the fall of 2020, and our work continues in education and outreach efforts to agency staff and stakeholders, as well as expanding services statewide. The state has also engaged in collaborative efforts across agencies and bureaus, both internally to DHHR and externally to achieve our identified goals. Collaborative efforts within DHHR have resulted in a streamlined process to access intensive community supports for children and families in need. Services include children's mobile crisis response, positive behavioral support, assertive community treatment, and high-fidelity wraparound. The state is currently developing its education and outreach plan to ensure all of our partners and community members have a clear understanding of how to access these services and the many benefits to providing effective interventions to children in their homes whenever possible. Unfortunately, not every child can remain safely in their own home. To improve the experiences of children in care, the state has been working towards enhancing foster home settings and increasing the use of kinship relative care. When children require placement outside of the home, several factors contribute to positive outcomes. One of these factors is placement with a relative caregiver. Placement with kinship relative caregivers minimizes the trauma of removal, it improves behavioral and mental health outcomes, and preserves family culture and community connectedness. West Virginia prioritizes identifying kinship relative caregivers when the placement of a child becomes necessary. West Virginia emphasizes diligent search efforts both at removal and consistently throughout the life of the case. Search efforts are facilitated through staff interviews with children and families through Family Finding, a service provided by Mountain Health Promise in which a genogram is built of possible kinship relative connections. Once located, West Virginia operates a Kinship Navigator program to support these homes. When placed with a kinship or relative caregiver, a referral is made to our Kinship Navigator program. A program navigator immediately contacts the family and completes a needs assessment. The navigator then begins locating resources to support the placement. They may obtain financial resources, bedding, emergency food, and anything that is vital in the first few weeks of placement before other services may be available. This leads to stability in the home and reducing caregiver stress and tension. As a result of these efforts, more than half of West Virginia foster children are placed with kinship relative providers. In addition to Kinship Navigator program, West Virginia also has a community-based foster parent network. The purpose of the West Virginia Foster, Adoptive, and Kinship Network is to build a statewide network of foster, adoptive, and kinship families for advocacy and support. The network provides group and individual support to help families navigate difficult and challenging situations. It provides training and enhances reunification through building relationships between natural and foster families. These efforts help reduce trauma for children and stabilize placements to avoid disruptions. This peer support and training helps families feel heard and valued, get timely answers to their questions, and build community with others who have similar experiences. For many children, placement outside of the home also means enrollment into a new school. Every school change for a child has the potential to set them back academically by 6 months. Children transitioning schools need additional support to stay on track. The West Virginia Department of Education has developed 2 services to help children have a successful transition both into and out of foster care. Education Recovery Specialist and Transition Specialist collaborate with foster parents, caregivers, the child's caseworker, and local county boards of education and others to ensure foster children have no barriers to enrollment or obtaining the services they may need when transitioning in and out of foster care. The state has encountered barriers to meeting its goals. One barrier is consistent messaging about available services and supports across bureaus, stakeholders, and the community. Messaging about available services can be fragmented and incomplete. Another barrier is that, similar to communities all across the country, West Virginia is experiencing workforce issues which make bringing some services statewide difficult. Lastly, shifting the philosophical beliefs of our staff and stakeholders to emphasizing and prioritizing community-based supports and removal as a last resort is a barrier. As the state has worked to build and implement these services and programs, it has learned that written, strategic communication plans are paramount. Shifting philosophical beliefs requires consistent messaging and a commitment from all stakeholders to facilitating these changes. As West Virginia continues to strive towards meeting its goal, it will take the lessons learned forward to achieve success.